Well, good evening and welcome to another episode of Rich Politics with me, your host, Richard Taylor. Thank you for tuning in. Don't forget to hit the subscribe button and follow us on all the social media platforms. Well, we are in the middle of a summer break, but I had to bring this interview to you tonight with my guest because I feel it's so important right now that you hear what he has to say. Jamie Jenkins is a media commentator and a statistician. He worked for the Office of National Statistics, and he's been following the government's handling of the pandemic in this true and real form when it comes to the real numbers and figures. And he joins me now here on Rich Politics. Jamie, welcome to Rich Politics.
Hi, good evening. Are you okay, Rich?
I'm very well, thank you, mate. I'm so glad to have you on because, of course, the news tonight, we've just heard that the government have rolled out the idea now of those who are 60 and 70 are receiving the vaccine. And of course, we're going to talk about a lot of things tonight, probably the vaccine passports. But of course, your skill set is, as a media commentator and statistician, is about the statistics, the numbers. What they really tell us a story about how governments have handled this pandemic, Jimmy, don't they?
Yeah, well, if we start on that one, actually, Rich, I've been crunching the numbers because we saw the leaks. And then one of the things with the government is you tend to find out the policies through the media before you hear from the government. And that kind of happened again today with the announcement about 16, 17-year-olds having the vaccine. And if you take the data, Rich, and probably start with the worst outcome that you can have, which is deaths. And what we've got in England and Wales overall, we've had 44 deaths where somebody aged 0 to 19 has sadly died, and COVID was mentioned on the death certificate. But what you can do is you can dig into the data a little bit more and look at Nhs England. Now, with the Nhs England data, they actually break things down on people who've died with a positive test. It's a similar number to what ONS have got, but they actually identify if somebody had a pre-existing medical condition or not. And if you do that, what you find is that 80% of people who are aged 0 to 19 who've died with COVID have actually had a pre-existing medical condition. So when you're actually looking at the data for, say, the children age group, you're probably talking less than 10 people out of 141,000. So that's a huge number now, as you see, in terms of deaths, where there's been mentioned on the COVID, on the death certificate, less than 10 out of 141,000. But remember, 16, 17-year-olds who had a pre-existing medical condition were able to have the vaccine and have been recommended to have the vaccine. That was before the recent announcement of extending it. 12 to 15-year-olds can have the vaccine. So I think the data in terms of deaths suggests that I don't think having the vaccine for 16 and 17-year-olds is to prevent deaths. It's probably for other reasons.
Yeah, it's not significantly going to have that, as you mentioned. The worst case scenario is death. And when you look at the numbers, and as you've mentioned, as somebody who's trained in statistics and you know it very well, as someone like myself who just reads a lot of information online and, of course, the news and not always mainstream media, but, a lot of the stuff that we get, I find it extraordinary. The government seem to be coercing young people. And first of all, let me just put it to our viewers here. First of all, it was let's vaccinate the elderly and the vulnerable. Completely understand that. Underlying conditions, all that stuff. At the start of the pandemic, I fully supported this government and the vaccine rollout. I actually applauded it. I said they're doing an amazing job. Fantastic. Thank God we wrote to the EU because we wouldn't have rolled it out as quick as we did. So I'm not anti-vax. This is important for viewers to know because they think I am. What I'm opposed to is this idea. Now, it seems to me as if the government are pushing a narrative that it's moved from flattening the curve to let's get the whole entire population jabbed and taking away the freedom of choice. Now, people say, yeah, we've still got a choice to be vaccinated, but it's the coercion the government is playing on us. And it's kind of like, well, if you get the jab, you can have a kebab. If you don't have the jab, you can't go to a nightclub. If you don't have the jab, you can't travel. So basically, if I don't have the jab, I can't do bloody nothing in my social life. I can't live my life freely. So they are taking away freedoms. And I think that's the concern a lot of people have got. Certainly what I've got, Jamie. And talk us through the statistics in the sense that those from birth to 19 years of age, you've mentioned the numbers there. Why do you think the government are pushing this idea of vaccinating young people? Because I think they're going to go a lot for our children. I think it doesn't stop at 16, 17-year-olds. I think they're going to say, or encourage at least, not force our children. Why do you think the government are doing this?
Well, yeah, so I think there's a few things going on here, Rich. So the first one is if we focus on the deaths, what we know is that the majority, over 80% of all the deaths have been people over the age of 70. And then of those who've died who were younger, they've generally got pre-existing medical conditions. And so in terms of the vaccine, what we do know, and Sajid Javid is a good example of this, is that having the vaccine does not stop you getting the virus. It doesn't stop you passing it on, but it significantly reduces the likelihood of you doing it. I think some estimates have come out today saying 50%. So, and the kind of the science behind that is that if you've got a vaccine, you'll have some antibodies within you. If kind of the virus you catch in, it starts attacking you, you'll have a lower viral load. So I think what they're trying to do today, because if you look at the studies come out today, Rich, looking at children and COVID and people who catch it, and what the study shows is the majority of children actually don't show symptoms. We've identified loads of cases in children because there's been a lot of testing going on in children whilst they were in school. And then if they catch COVID, very few of them have symptoms. But then those who do go on to develop symptoms and actually get ill, the majority of them don't get seriously ill. And they use the kind of the Zoe app tracking thing where we're looking at symptoms. And what they found there is that 4 weeks on from people who caught COVID and had symptoms, fewer than 1 in 20 had symptoms kind of 4 weeks later, and about 1 in 50 had symptoms 8 weeks later. So we know the children don't get seriously ill. I think what's spooking the government is what we've seen in England since Freedom Day kind of came in, and we saw it in Scotland when the schools broke up there, is that there seems to be a coinciding between the schools closing, and if you think about a virus, basically the human is the host. The humans got the virus. Children are still the same as kind of adults. They don't get ill with COVID, but they could be hosting the virus. You've got all this mixing going on in school, and then that might be causing wider transmission in the community. So I think cases have come down, and it's probably spooked them and thought, right, if we vaccinate children and 16, 17-year-olds, and they're trying to get, obviously, people under the age of 40 where rates are a bit lower to have the vaccine, if we can vaccinate them, then that might slow the spread of the virus. But we know that the younger you are, you've got to start balancing up that risk between the benefit of a vaccine versus the risk of the vaccine. So they're
well, Jamie, as you rightly pointed out, the figures don't lie, right? You get these figures, and you can collate them from a whole range of. This has been your experience in a professional job for years, and when someone like you tells me those figures, I think, well, why are we pushing this narrative, especially politicians, of vaccinating children when the risk to them is so significantly? I mean, it's almost non-existent when you look since the pandemic began. And for me, I find it almost like the government want to intrude on our personal lives. And I know people will say to me, watching this as well, well, Richard, no one's forcing them to have it. Well, I'm of the opinion that the way the government have gone about this, through propaganda, through using the media, through YouGov polls, which I don't trust, which was set up by the Vaccination Health Minister himself as well, who's part of setting that up, pushing a narrative that young people, want the vaccine, they should have it, when they're not at risk. We were told, Jamie, were we not, at the start of this, it was the elderly and the vulnerable with underlying conditions that were more likely to die from this virus. And the figures are going. Now, one of the things that I picked up on social media last week, is scientists are baffled. So these predictions from people like Neil Ferguson, 100,000 deaths, with this new pandemic. Even Keir Starmer himself quoted it. And that tweet didn't actually age very well, made himself look completely stupid, because all of these prophets of doom about the apocalypse, the end of time because of this virus, they're not proven to be true, really, are they? Because the stats don't tell us that.
No, and people are wondering why cases have come down. Well, as we've kind of alluded to a little bit there, they closed the schools, and we did have the Euro football tournament, which may have seen a lot more kind of mixing going on, and it's going to be eased off. But cases have come down, and this is what's kind of baffling some of the experts and the scientists, as you say, is Neil Ferguson. He's done so many models that have been completely out. I'm not quite sure why he's turning up on the BBC every other week, kind of talking about new numbers and stuff. But I think cases are coming down, and they're not just coming down in young people, though. So we talk about the schools. The important thing is I track each day on my Twitter profile the cases and the age groups and things. They're coming down across all age groups, which is really, really good. So we're at that point now where people are thinking, oh, well, if lockdowns in the past had brought the cases down, well, what's happening now? And I think, obviously, we're in the middle of summer, and the acid test, I think, Rich, in terms of going forward with the policy, is Scotland have announced to Nicola Sturgeon yesterday that they're going to start going, basically easing more and more restrictions. They're not going to go as far as Boris has announced in England, but then the schools go back a little bit earlier there, and we'll see a rise in cases. But ultimately, you bang on with what you said in terms of the vaccine rollout was there to kind of stop people dying. And we know the people who are dying are the more vulnerable people, and they've had 2 doses of the vaccine several months ago now. So, and it's clear the vaccines are having an effect, because if you track the data and look at the number of cases, We saw a big rise in younger people in this recent third wave. We've not seen the same rise in older people because of the vaccine effect there. And hospitalizations and deaths are about 80-90% lower. So ultimately, Rich, we don't vaccinate everybody for the flu, and the flu can just be as deadly. I would hate to think what the numbers would be if we kind of didn't vaccinate people for flu a few years ago when we had this huge excess deaths from flu. We don't vaccinate everybody for that, but there does seem to be this push to vaccinate everyone from COVID. I think it's partly to do with the fact that COVID's rammed down our necks every single day on the news. How many people have got cases, how many hospitalizations? It's COVID every single day on the news.
Well, that mixed with the Olympics at the moment as well, isn't it? When we talk about the Olympics. I was going to ask you then, Jamie, about the figures then, because mortalities and deaths year in, year out. So say the last 5 years, if you track things as you statisticians so cleverly do, I mean, what is the average deaths in a year, let's say pre-pandemic as opposed to post-pandemic? How does it balance out? Are you with me? Like, so how many people normally die in a year from other illnesses? Given, post then COVID, how many are dying now? Is it significantly higher, less or more?
Yeah, so we'd normally in the UK get around 700,000 deaths a year. And what we saw when the pandemic started last March, it kind of crept up on us. And then what I was looking at, and the government was looking at as well, is that, and this is what Chris Whitty actually was saying at the time, that you need to look at kind of all cause mortality, not just COVID deaths, but how many deaths are above average for the time of year. And we had about a period for a couple of months at the start of wave one where deaths were significantly higher. And in part, that was down to some of the kind of, a lot of people died in care homes, the elderly. And then we started seeing deaths then relatively low throughout last summer. And then in the second wave, we started seeing deaths above average around Christmas and January time as well. So those deaths above average has shown the impact of the pandemic. But since March, what's really interesting is that with most of the vulnerable people that we've talked about having the vaccine, in some parts of the country, and in Wales where we both are, Wales has had deaths generally below average since March, although they didn't seem to be using that evidence to ease restrictions in Wales. I know Mark Drakeford was doing quite a number of briefings where he kept saying, well, I need to see more information on the effectiveness of the vaccine, slowing things down. But since March, most of the time in Wales, things have been actually kind of below average. Now, what we might see actually, Rich, because we know the NHS has been practically closed for a number of patients over the last year, is in the coming years, we might start seeing the issues of perhaps cancer patients who haven't been diagnosed, all the other things. And what's a really interesting statistic, and I think some further research is definitely needed in this, is you can look at the excess deaths and why they've occurred. And what we've seen since the start of the pandemic, that more people are dying from home than before the pandemic in every single week since the start of the pandemic, which probably suggests some people are too scared to go to hospital. Yeah. Maybe hospitals aren't admitting some patients that they would have done in the past. And if you look at deaths at hospital, there's fewer people dying in hospital at the moment now than what you would expect for the time of year, but there's more people dying at home. So is the NHS open for business? I'm not quite sure.
Well, I think the government didn't help by saying, look, we're here to protect the NHS. Really what we've always, growing up, the NHS is there to protect us. And I think that whole thing changed. In fact, the Guardian news just broke this evening, and if you saw it on social media, the Guardian have reported that the NHS in England, I should say, I don't know if it includes Wales, has been recorded as one of the worst health care services in Europe. I don't know if you've got that. It's just come through on my phone now. So I'm not sure if that's true, but it's just come through. But it's interesting. The NHS really, we were told to protect the NHS, and we all got that. We all, at the start, the first lockdown, listen, we were all, yeah, no problem. We'll follow. We don't know what this virus is. We followed, the Welsh government, the UK government, absolutely down to the letter. But I think as time has gone on, fatigue has settled in. People are fed up of lockdowns. We don't want to go back to those days. The vaccine, of course, then was discovered in record time, regardless of what the government might say and what I've heard many politicians tell me, say, well, look, we're at stage 3, which is the stage where clinically, it's accepted that that vaccine is safe. I personally would rather wait further down the road for more data to come out on it, because I don't think we have enough data yet. And anybody who speaks out against it like this as I am demonized. I am called a murderer. I'm called, someone who wants to kill people just for having an opinion on the freedom not to have a vaccine, because I'm being cautious about it. And I mentioned off air, I'm not anti-vax, Jamie, as you know. My 2 eldest sons have had it. They're 21 and 19. You know, they said, Dad, we want to have it. That's fine. You know, I talk them what I think, but it's their decision. And I just think that the way that the government have gone about this, certainly, you know, the UK government, and of course, you're in Wales with the lockdowns that have had such an impact on people's mental health and people dying of other illnesses because they're not going to their GP. You can't get a GP appointment in Wales. I mean, certainly not in the valleys here. It's very difficult to get an appointment. And people not going to hospital because they were told, look, don't go, protect the NHS. And I think there are other figures yet to come out, and we won't know them for many years to come, Jamie, don't you think?
No, that's true, Rich. But there are some figures that we have had, but you don't see them kind of on the news every single day. So the Office for National Statistics, where I used to work, they do a kind of a survey to understand the prevalence of mental health issues. And pre-pandemic, it was around 5 million people were reporting symptoms across the whole of the Great Britain. This is now which the kind of depressive symptoms. Now, since the pandemic, it's doubled to 10 million.
Wow.
No, that's a huge number of people, 5 million extra.
So since the pandemic, it's gone from 5 million to 10 million people suffering with mental health issues.
Yeah, with mental health issues. And I've seen the stories on if you go on the internet and look for them. And I don't mean some dodgy websites, proper, even on the BBC and things that looking at the news has been reported there, where some patients can't get mental health treatment because all the beds are full for mental health issues. So one of the things we know that with lockdowns, it'll suit perhaps some people, but it won't suit others. So we've seen a doubling of the mental health pandemic. The thing for me with this, Rich, is obviously we find out how many people have COVID because we have these tests. And I know there's a lot of criticism of the lateral flow test that kind of in America, they've said, put them in the bin. So sometimes criticism about the PCR test, but let's just go with what we know and what we have. But you don't generally have a test for mental health issues. So we could be way underreporting kind of the mental health problems that have occurred from all of this, because I and you might have got the same. So I've had friends who've lost jobs because of the lockdowns have meant that businesses aren't open and the businesses couldn't really access some furlough or decided to restructure. So the long-term impact of all of this is going to be considerable. And remember, whilst COVID was going to has impacted most health-wise on the elderly, who's going to be paying for this forever, for a long time? Are going to be the young people for a few reasons. Their education's been ruined. The people who've been to university have been kind of doing lectures online. And even those who are graduating now at the moment, Rich, they're going into a labour market, which is not quite kind of strong. And what research will show, if you start graduating into a time where the economy is not very strong, that can have a long-lasting effect on you, because you might find a job and never leave that career that you've just gone into. So I think the consequences of all of this will be probably in 5, 10, 15 years' time, will still be hitting people at the moment.
Yeah, Jamie, listen, we've only got a few minutes left. Our half hour's almost up. I wanted to really talk to you a little bit about Wales in particular, because we're both living in Wales, both Welshmen, proud Welshmen as well. I know you are. What do you make of the Welsh government's handling of the pandemic? I mean, my opinions are well known. People know what I think. But because we hear from Mark Drakeford and from the Welsh government, from their PR team, how well they've handled it, how fast the vaccine has been rolled out and everything else. And they say they're not competing with the other nations, but let's be honest, they are, to say we've done it better than you kind of tact, I mean, have the Welsh government really handled it better than the UK government as a whole?
Well, I think the first thing to say for me personally is that they should never have been handled by the Welsh government, because the virus doesn't know where Offa's Dyke is. And having these different rules on one side of the border and another side of the border completely makes no sense whatsoever. And I think personally, a number of the rules between differences in Scotland, Wales, Northern Ireland and England have been political decisions rather than decisions because of the pandemic. Remember, we kind of went into lockdown and it started off with Boris Johnson making his announcement. And then the ambiguity started kicking in as we started coming out last year. And Wales eased restrictions a lot slower. I think the thing for me with the Welsh government is they don't have any accountability with the Treasury. So if you take with regards to if you lock down or you put more people can't work, well, it's the UK government that has to bail out the money in terms of that or not. So I think in terms of the handling, it's best to come back to the facts. And the facts would show that if you look at the second wave of COVID, where the Welsh government had full control over the policy, they decided when we went into lockdown, they decided on local rules. They decided everything. Yeah. What we've seen there is that the second wave was worse in Wales than it was kind of in England. And that's where Mark Drakeford is in complete control of things. So the facts there would show that more people died than they did in England when you look at it as a ratio of the population. There's other things as well that I don't think we learned much from the first wave, that the number of people who would go into hospital without COVID, catch COVID within hospital.
Well, I think the BBC reported 25%, or around about 25% of people that caught COVID caught it in our hospitals here in Wales. I think that's right, isn't it?
Yeah, so the figure there is, so of all the deaths in Wales, 25% of them are people who went into hospital without COVID, caught COVID within hospital, and then sadly died. And, that's a tragic story, isn't it? Now, maybe some of those would have sadly have died anyway, but, you went into hospital and you where you think would be somewhere that's going to protect you and save you. And I'm not blaming the staff for all of this. They probably, have they had the right equipment? Have they had the right support with all of this? That's another story. And that's where we probably need a Welsh only inquiry, because Mark Drakeford seems to be keen on, he'll blame Boris Johnson for something if he thinks Boris has done something bad. And he won't have a Welsh only inquiry when he's been quite clearly maintaining that we're running the show here in Wales. And what's he running away for, Rich?
Yeah, I know. Well, the thing is, I've been calling this myself, not on social media. I've been writing to a number of people as well about it. And the Welsh Conservatives, I'm glad to say, are very supportive of the idea of an independent Welsh inquiry, because I think it needs one, because where's the accountability there? But also, I've noticed the Welsh Conservatives have come out today. Russell George wrote a piece for the Conservative Home here in Wales, discussing the fact that they are completely opposed to vaccine passports here in Wales, which his boss in Westminster, or Boris, doesn't seem to have the same tact to be able to, or the balls to say the same thing, if you know what I mean. So at least the Welsh Conservatives are coming out with the right stuff at the moment here in Wales, I'm pleased to say. But the whole idea of Wales has done better than elsewhere, to me, has been a lie, because there was one stage, you mentioned the second wave, the amount of deaths were extraordinary in Wales, what was happening. And I know Mark Drakeford was using, well, we've got an elderly population and we're more deprived in Wales. Well, we're more deprived in Wales because we're under bloody Welsh Labour. That's my opinion on that anyway. But going back to vaccine passports, I want to finish off on this if we can, Jamie. What's your position on that? Not that you need to take one, because I know that you're professionally involved in media commentary and statistics and stuff like that. But, do you think that this is moving towards a digital ID? Do you think this is something, an overreach of the government? They've gone too far on this if they mandate it. Of course, they haven't, have they? It's like, well, we let businesses decide, for example. I mean, we haven't heard nothing about it in Wales, surely, have we? What's your thoughts on that?
Well, actually, this is one area I think Mark Drakeford has come out and in one of his press conferences, he said it's not the role of government to mandate these vaccine passports. And Boris is kind of thinking of going down this road. For me, it kind of shows the shambolic nature of these U-turns that the government keeps coming up with, because we had ministers going on Andrew Marr's show and across Sky News and other outlets saying, we're not going to have vaccine passports. I don't think there's any need for vaccine passports, because, what are we going down to? And there's a few reasons for this one for me, Rich. First of all, one of the things is when you look at, put my statistician's head on, when you look at data protection, one of the most protected bits of data that you have is your medical information. So providing companies, if you're booking a ticket to the theatre, or if I want to go and watch, say, a Tottenham Hotspur match, and have I got to tell them that I've got a COVID, go give them proof of a COVID double vaccination before I go, they'll actually have your medical information. Now, I think what's probably going on here is that it's more of a coercion tactic, which in of itself is a bit of a dodgy thing itself, to announce that, yeah, you're going to need a vaccine passport to be able to do X, Y, and Z. People will start talking about it, and then people think, oh, I better go and have my jab in case I can't go and do something. People should be taking the vaccine for the right reasons, not for reasons where they might not be able to do something if they wouldn't do. So domestic vaccine passports for me, Rich, I don't see any role in society with regards to all those. I kind of get why you may need them to go abroad, because other countries, they're at the liberty to do what they would like. And we've had vaccines to visit certain parts of the world in the past, but to go to the pub, the theatre, nightclubs, makes totally no sense whatsoever. I'm opposed to them, Rich, and hopefully this is just one of those things that's been talked about but won't see the light of day, because where does this stop? You have vaccine passports. What happens next? That's my big concern with that.
It is an overreach, and what happens next? Well, Jamie, listen, our time is up. Thank you ever so much for joining us tonight, Rich Pottis. Really appreciate it, and thank you for coming on. Well, folks, thanks for tuning in and joining us tonight here on Rich Politics. Don't forget to join us the next time we're on. As I mentioned at the start of the introduction, we've broken into the summer breaks. I really wanted to get Jamie Jenkins on to speak to him about the statistics, because he's the professional one, I'm not. And really appreciate having him on. So we'll tune in next time when we're on. And of course, follow us on all the social media platforms. And don't forget to subscribe. Hit that button under there to the channel. Catch you soon here on Rich Politics. Bye for now.